Hi, I'm Dr. Blair Masters with Arkansas Physical Health and Rehab, and I wanted to talk about something I get asked on a very regular basis, and that is about painkillers. You know, patients come to us in pain. That's one of the major reasons why people go to the doctor, and I get questions about over-the-counter painkillers on a regular basis. Let's talk about what some of the facts are. You know, if you're in a situation where you have pain, then you always need to ask the question, well, why do I have pain? Oh, if it's obvious, I sprained my ankle, I hit my head or something, I got in a car accident. These sorts of things are, here's the reason and here's the consequence. And then take action to get rid of your pain. And if that includes over-the-counter painkillers, that is fine. That is not a problem. The problem comes when you go from the small bottle of the Tylenol to going to the large bottle of the Tylenol and consuming it on a daily basis. You know, pain is a normal part of your body's reaction to what may be going on around it. But if you're in pain all the time and there doesn't seem to be an end to it or no reason for it, then you've got to ask the question, well, why is this happening? It's not because you have a deficiency of Tylenol in your bloodstream. You know, that's not really it. So what can you do? Well, first of all, come into the office and let's try to figure out what's causing your pain. Many times it's an imbalance in what you're eating. People eat pro-inflammatory foods, but short of that, what can you do at home? You know, putting an ice pack or something like that on a painful area. Ice is one of the best anti-inflammatories you can get. It goes right to the problem area, and rolling your muscles that are fatigued or fibrous or overworked can make a big difference. Stretching really helps. These kind of things really help pain on a regular basis, and I would definitely recommend you apply them. Exercise has been shown to lower pain. There's just all sorts of things that can be done short of resorting to the larger bottle of Tylenol or ibuprofen or something like that. So investigate, figure out what's causing your pain, and then take steps to make sure that you don't end up with chronic pain, because that's your body telling you something's wrong, and short-circuiting that process isn't a good thing.